I want to welcome you to the Teleophthalmology curriculum introductory video. The COVID pandemic brought in a lot of challenges, highly contagious disease with high mortality rate. How do we take care of our patients? We needed to better understand the disease, the duration of the pandemic, safety of patients, staff, and doctors. We had to protect them. Challenges with cross-covering. A lot of us actually served on the COVID floors. And with our field, with heavy reliance on imaging and technology, how do we take care of our patients? When we reopen, are there going to be restrictions for taking patients? And of course, are there going to be COVID casualties, missing diagnosis, infections, loss of vision? On March 8th, the CMS eased restrictions on telehealth to try to take better care of patients in general during this pandemic, especially that patients were restricted and they cannot come to the hospital or the doctors. In our institution, within 2 weeks of easing restriction on telehealth, we were able to launch the virtual visits in our department. Within 4 months, we were able to do more than 1,500 virtual visits. The National Committee for Quality Assurance published a report actually in September 2020, reviewing all the telehealth visits during the COVID pandemic. And it concluded that telehealth enhances patient care and minimizes travel. It's a new modality of care delivery, and it's not going to increase cost of healthcare. Actually, it will lower cost of healthcare. In addition, it makes overarching policy recommendations, suggesting lifting geographic restrictions and limitations, allowing telehealth. It did acknowledge that telehealth visits can meet requirements for establishing clinician-patient relationship, and recommended eliminating unnecessary restrictions on telehealth. Dr. Habash and I met and discussed creating a teleophthalmology curriculum to teach the residents, the fellows, and general practitioners about telehealth, as this is going to be a new modality of care delivery, and we need to teach the new generation on telehealth. I solicited my innovation fellow, Dinah Chin, to help with this project. We reached out to national and international institutions to see if they would be interested in helping us with this curriculum and to share their experiences. We created a framework for the videos for overall view, best practices, workflow, regulatory, billing, and future directions. We wanted to cover the history of teleophthalmology and COVID, best practices, teleophthalmology in the ED, resident and ER and inpatient telestaffing and triage. We wanted to cover outpatient follow-up, new diagnosis, post-op, and triage and virtual urgent care, in addition to remote monitoring. We wanted to go beyond teleophthalmology visits, similar to online communication, virtual counseling, and hybrid testing, remote screening using autonomous AI, with or without autonomous AI, low vision, consultation similar to doctor or second opinion, health equity and telehealth, and international teleophthalmology. And I want to thank everybody who participated in this effort for their help, because this would not have happened without their help and support. We welcome you to attend all the videos. Thank you.